Hey everybody, it's me, Senor Rivera. Yes, I just came back from the emergency meeting at St. Johns County Administration Building about this whole coronavirus thing, COVID-19. There's a lot. So I recorded what I thought was important. I did run out of battery at one point, so you lose like 3 minutes. Not the end of the world there, but listen carefully. There are things for 501Cs. There's things for the self-employed, people who have up to, so many people on their payroll, hundreds of people on their payroll. Walsh, the congressman, it talks. Rutherford talks. The commissioners talk. The health director talks, the county administrator talks. So everybody who's important in this issue talks. So listen carefully. There's a little bit for everybody in that. I've gone to some of these before, and this one was a nail biter. It was good to listen what's going on with the coronavirus here in our county and in the state of Florida. So I know a lot of you also are worrying about family members. I have a daughter who used to smoke, this virus would probably hurt her. And she goes to work every day. Have a sister who's in the middle of it. She works at Precinct 11, Midtown, and she's surrounded by cops. She's wearing her gloves, her mask, but she's surrounded by cops who are getting sick every day. So she's playing Russian roulette. I have a son who lives in France. 2 of his family members there have been infected, and he's also type A blood type, which is not supposedly good if you catch this virus. So we worry a lot, and I my heart goes out to you because I'm in that same situation. So keep calling them, stay in contact with everybody. If you know someone in your neighborhood that lives alone, give them a ring, knock at the door, and then step back 6, 7, 8, 10 feet. Ask them, are you doing okay? They might need some groceries. They might need some medication. It's a hard time for older people who live alone. It's about community, people. So knock on those doors, make that phone call, send them an email, text them. And if you have to knock on the door, knock from far away, get their attention, and make sure they're okay. All right, so we're in this together. Viva la revolución. Catch you on the other side.
Be confirmed. If not, good morning and welcome to this special meeting of the St. Johns County Board of County Commissioners. In order to mitigate the transmission of the coronavirus and the reduced risk of COVID-19 illness, the governor has suspended the requirement of a physical quorum, and the Board of County Commissioners has adopted procedures to conduct meetings using remote participation through emergency proclamation number 2020-3, so that the public has a means to comment without physically attending as well. Along with prior communications, including email, the public will be able to comment by telephone while watching the meeting via
Yeah, Mr. Chair, if I may, for the actual agenda of materials, in case they have not all been placed on the website because some of these were late breaking, I'd like to put them briefly on the overhead, just so the public knows where we're going on this, if I may.
Whoever's in the back, if you could have the commissioners mute their phones, would be helpful.
Same here again, I'm not hearing anything. Yeah, I'm trusting the same thing here. No through audio. How are you? Yeah.
All right.
Yeah, Mr. Chair, Commissioners, and the public, this is the proposed agenda today.
Now we're going to move forward with the comments. I believe we have Congressman Waltz on the telephone, and and we'll listen to Congressman Waltz. And then we also have present with us this morning Congressman Rutherford, and he'll come up after Congressman Waltz. And thank y'all for being with us today.
Well, hello everyone. Can you hear me okay?
Good morning. Yes, sir. Thank you.
Sure, my pleasure. I just wanted to thank you so much for having me, and thank you for all of the work that you're doing in behalf of all of our constituents and the folks that we represent. I just wanted to take a minute and walk you through some of the legislation that Congress recently passed, primarily the Family First Act and the CARES Act, which were the two of the three stimulus packages that Congress passed in the most recent weeks. The CARES Act primarily, which was much larger of the three, $2.2 trillion that you probably all have seen on all over the media as Congress wrestled with itself and the administration to get this through. But it has a number of very good provisions. I have to say, as a fiscal conservative, that was quite a large pill to swallow. I do want to say that is, and we all have to acknowledge, that is our grandchildren and their children's money that eventually someone will have to pay. But right now we have to get through this crisis, and I'm proud of some of the provisions that I was able to work with Senator Rubio's office, who's the head of the Small Business Committee in the Senate. Number one, focused on individuals, is the tax rebate check. Those are, as I'm sure you all have heard, are $1,200 per person, $500 per child, with an income cap of $75,000 for individual, $150,000 for those filing as married couples. One important, I think, detail there that is worth getting out is that that's based on 2018 IRS filings. The Treasury Department aims to get that out by April 6th. Those checks out for those who need checks and for those who have direct deposit information already on record with the IRS, then those should be direct deposited. So that's the individual relief piece, and again, that is targeted at those most in need. On the small business side, which is where we work primarily and really focused our efforts, you've heard perhaps of the payroll protection program. That is aimed at helping small businesses keep people on their payroll. Number one, it provides a loan to small businesses defined by under 500 employees for equaling 2.5 times their payroll and overhead. Provided that the small business keeps their employees on their rolls through June 30th, that loan will turn into a grant. So that's almost a quarter of your annual cost in terms of payroll and overhead that a company will receive and will drop right to their bottom line. And again, with the aim of helping them keep those folks on their payroll. Another provision is payroll tax relief and deferring those payroll taxes to 2021 and 2022. And then there's some other provisions there that are in there in terms of debt relief, forbearance, and other types of mechanisms that help with all of everyone's bills that are actually coming due today and tomorrow with the first of the month. So for so many of these businesses, this is just a brutally difficult time, and I'm incredibly sympathetic. I've talked a number to you about my efforts for veterans, and as a Green Beret and a combat veteran, that's near and dear to my heart. But I was also a small business owner and helped build a company from scratch up to about 400 employees before I stepped away from the business to run for office. So I fully appreciate what it means to have to make payroll, to be a personal guarantor on a line of credit, and all of the risks that our business owners take in order to to serve their customers, but to do everything possible to take care of their employees. So I'm deeply sympathetic and was thrilled to get some of these provisions in that I hope all together will help our companies bridge through these times. The third piece is our broader packages designed to help larger companies, particularly those with our critical infrastructure, like airlines and other types of companies that we will need in terms of our economic recovery. And for all of these programs, the Treasury and the SBA and the IRS are still working through their implementing instructions, meaning the details on exactly what forms you would need to bring, the timeline for turnaround. I can tell you, in speaking with Secretary Mnuchin, the Secretary of the Treasury, his goal is to get the payroll portion, those loans that can be forgiven and turned into grants, up and running by the end of this week. So in the coming days, I would encourage business owners to go ahead and begin reaching out to their banks. And I just received a notice from Bank of America personally on what provision, what documentation that they would want to see. One of the things that Senator Rubio and I pushed hard on was to not have SBA as the sole processor, because I'm convinced that the bureaucracy would become completely overwhelmed and that we would just end up having a backlog. So the Treasury is saying they were going to push this program out through as many banks as absolutely possible. So I would, as the first step, ask your banks if they are approved to process these applications and to push these programs out. A few other things that before we run out of time, that I just want to make you aware of. One, for our seniors, many of which, if you're over 72, you have to take mandatory distributions from your retirement account. That is suspended, I believe, for the rest of 2020, so you don't have to sell your assets into a down market. If you don't need them, you can leave them invested. The other is, if you're having some type of corona-related emergency, you can take up to $100,000 out of your retirement account early without the typical 10% penalty. And then finally, near and dear to the county commission's heart, Florida should be receiving $8 million to help with corona-related expenses. How that will be dispersed throughout the state, I'll leave that to our very capable state reps and state senators. But from my perspective, we were able to get $8 million pushed to Florida. And I know we all know there is going to be a gap between revenues and with the economy taking a nosedive and expenses. And so I do expect there's already discussions on a fourth package that will be aimed towards helping state budgets and how to flow that down to county budgets that I know also have to be balanced. State and local budgets have to be balanced, the federal does not. Again, that pains me as a fiscal conservative, but I think right now in such a time of crisis that we stand ready to help. I think with that, I'll stop. I just wanted to walk through the major portions of the program. And I just want to close in saying, as a veteran, look, the enemy's bullets, they don't care. Down in the foxhole, they don't care about race, religion, socioeconomic background. They certainly don't care about Republicans and Democrats. And this virus doesn't care either. It does not discriminate. Fortunately, I think North Florida and Central Florida is standing pretty strong right now in terms of numbers of cases and unfortunate deaths. But my job is to help all of us get ready and to keep it that way by providing the resources, just like we provide training, equipment, resources to our soldiers on the front line, while our healthcare professionals, which by the way did receive in our hospitals $150 billion out of this package to help them be ready on this front line as well. So thank you so much. And any questions that you have, please. I'm happy to take them now, but in the sake of time, I know we have Congressman Rutherford coming. Please reach out to my staff. Our district director, Ernie Aldino, General Aldino, stands ready. And we are regularly holding roundtables with with our chambers of commerce to answer business-related questions, and I will be having a telephone town hall at 3:30 tomorrow for anyone to call in. That number is on our website, and we'll also be reaching out to constituents as well and calling them directly. So we stand ready to answer as many questions and take suggestions for how we could do things better to help everyone through this crisis. And thanks so much, and God bless.
Thank you, Congressman. We sure appreciate it. I don't see any questions, and thank you for your service. All righty.
No worries, and we will keep up the fight. All right, take care, everybody.
Yes, sir. Thank you, Congressman. Congressman Rutherford, thank you for being with us this morning. Thank you for coming in.
Thank you, Mr. Chairman and Commissioners. And first, let me say what a pleasure it's been to work with my colleague in Congress, Congressman Waltz, and also Senators Rubio and Scott. They have been great partners. I would encourage everyone that if you want to see the language of the bill, because there is a massive amount of, you can imagine with $2.3 trillion, there's a massive amount of opportunities in this bill for individuals, for small businesses, and large businesses. So I would encourage everyone, you can just Google CARES Act, C-A-R-E-S, CARES Act, and actually find the language for the bill and pour through it. It's only 880 pages. but Congressman Waltz actually talked about some of the items that I was going to cover as well. So I'm not going to go back over the Relief for Families Act. That's he covered that pretty well. But I am going to talk about a couple items in the Paycheck Protection Program that I think are important that he didn't talk about because of the time. First, I would say, who's this for? A lot of people want to know, well, does it cover me? We're a 501c3. Does it cover us? Yes, it does. In fact, it covers small businesses under 500 employees, as the Congressman said. It covers 501c3 nonprofits. It covers 501c19s. Covers all veterans programs and organizations, tribal business concerns in Section 31B2C, and all of those with less than 500 employees. And I think what's also important is to understand that it also includes sole proprietors, independents, and self-employed individuals. So don't think just because you're self-employed that this does not apply to you. It does. Now, the when in this, what time frames are they talking about? This defines the covered loan period actually beginning February 15th of 2020 and ending on June 30th of 2020. That's important to know because what they're going to do is let you go back, look at where you were, and then with your employees and carry that forward. Now, what is covered? The Congressman mentioned that the payrolls are covered, obviously, but there's some other things that you can use this money for as well. For example, you can also use it for paid sick leave or medical leave, insurance premiums, the interest on your mortgage payment for your business, or if you have rent. Now, it'll pay all your rent, but it'll only pay the interest on your mortgage, not the principal itself. And then finally, how do you apply for this? The actual information and guidance on this is going to come out of the SBA, and it should be online at sba.gov on Friday of this week. That's the timeline that they're aiming for. It's going to be a very short, easy process. These loans are going to be completely guaranteed by the United States government. So a lot of the other regulatory rules on getting loans from SBA are not going to apply here, like other loan checks, and none of that will apply. So it's going to be a very easy and quick process. But it is going to be, as the Congressman noted, we did not want to try to run this through SBA. There's just too many people that are going to be accessing this. So we wanted to spread that out throughout the community to all banks and credit unions. You didn't mention credit unions, but they will be lenders as well. Treasury is working hard right now to bring other organizations besides those that are already approved for these federal loans to also grow that number within every community. So one thing that you're going to be required to do is do a good faith certification that the loan is necessary due to the uncertainty of the current economic situation caused by COVID-19. That should be pretty easily done. As I mentioned, it waives the credit elsewhere test and some other things. Now, on the payback, here's the best part of this. If you use this loan to keep your employees on the payroll up to 90%, then after the 8-week period, your loan actually becomes a grant and you don't have to pay it back. Unless there are monies in that loan that you borrow that are not part of the forgiveness, and that would be a 10-year loan at 4%. 10 years would be the maximum at 4%. So that gives you a little more information on how this is going to work. If you already have an SBA 7A loan, one of the most important things in this bill, I believe, for the liquidity of small businesses, and that's what we're trying to do, is really give these folks some liquidity so they can get through this process. If you currently have an SBA 7A loan, you will get loan forbearance for up to 6 months. That means now you're not going to be forgiven that amount. Your loan will just be extended for 6 months. So I think that's a very important element in this. Now, how much can you actually get? We were talking about that earlier. On this portion of it, it's from $350,000 to $1 million. It's $1 million. As I mentioned, the guidance should be out Friday. And I think finally, I would say, again, we talked about as long as you keep your employees employed, your loan becomes a grant. Doesn't get any better than that. Now, there's a lot of other, as I said, there's a lot of other elements in this bill, and I would encourage businessmen and individuals to go read through this 880 pages. It's got a good glossary, so you don't have to go through every bit of it if it doesn't apply to you. But there's certainly elements there. And Mr. Chairman, as I mentioned earlier, I'd be glad to give you an electronic copy. And if you want to put that up on the city webpage, the county webpage, then that would be great to give folks access to that. I would close with this. The curve for Florida. You hear all this talk about flattening the curve. And the importance of that is so that we don't over stress our medical capabilities within our jurisdictions. As you see going on in some areas like New York and others. Reducing, flattening that curve, as they call it, is incredibly, incredibly important. Now, I want people to think about this. When you're asked to stay at home, to practice physical distancing so that we're not too close together as we are in here, which is good. I want you to think about this aspect. There are individuals, many in this room, I'm sure, and up here, because I know many of you are small business owners. There's a lot of people that are financially in ruin right now. That's why this $2.3 trillion rescue package is so important. But they're in financial distress because they're doing the right thing. They're doing what they were asked to do. If you don't need to go out, and certainly don't need to be in large crowds, these people are doing the right thing because they don't want to spread this disease. They understand we have to flatten this curve. If we don't, more Americans are going to die. If everything works great, the predictions are we're going to lose 100,000 Americans. Somewhere between 100,000 and 200,000 Americans are going to die from this disease. The better we do on flattening that curve, the lower that number will be. These folks, the taxpayers just spent, and look, this is not a bill. I would not have written this bill this way because there are things in here I would not have put in it. But I understood the exigency of the circumstance, and we had to pass it with some stuff that we didn't like, as Councilman Waltz mentioned, or Congressman Waltz. So my message to the community is this. People are financially hurting because they're doing the right thing. We need to all individually do the right thing. Don't be out in big groups and crowds spreading this disease when other citizens in our community have done the right thing, tried not to spread this thing by doing the right thing, and then others go along nonchalantly like nothing's going on, and they're out there spreading the disease and putting not only themselves, but our healthcare workers at risk. So I would encourage folks, if you don't need to go out, if it's not essential, don't go out. And I will close with that, and if you have any questions, Mr. Chairman.
Thank you, Mr. Congressman. I appreciate it. Are there any questions? No. Thank you.
Somebody has come from one of these states and is occupying a place, residence, hotel, what should be done about it? Because if they're not following the recommendations from the health department, they are potentially infecting other residents. Is our law enforcement aware of the procedures that are recommended by the health department or the governor? What do we do when we find bad actors, so to speak? Because it only takes one.
Concur. I couldn't answer for what our law enforcement is aware of. I am aware that there's a collaborative effort between local law enforcement and the Florida Highway Patrol, as well as we do have a system from the Department of Health in place that if we have those individuals who are not particularly adhering to it, we can work with our legal counsel and legal counsel here at the county level to ensure that they are quarantined appropriately and there would be actions taken. So there is a system in place that is legally enforceable, but with support from obviously our legal counsel at the Department of Health and local legal counsel. And of course we would need the support from the county commission.
So if someone finds out that an individual nearby is not following these requirements for self-quarantine or whatever it may be, what phone number should they call?
You can call your local health department and we would facilitate.
Thank you.
But the other concerns I have with that is I don't want to put our law enforcement at risk, not prepared to go to a house to make contact with these people who should be self-quarantined. So I think that should be held, sheriff's here, Chief Hardwick and Chief Fox, but I think that should be held more to somebody that's prepared to go in and take preparations and know what the signs to look for and to talk to them about it.
It's a
So
collaborative
I know it's
effort.
a lack of resources like
Well, it's a collaborative effort between our sheriff's office, our St. Augustine Police Beach. We collaborate every day, and we have cell phone numbers. This would not be a situation where the health department is going to walk. We don't have that authority. We have the authority in order to assist, and law enforcement has authority to work with us. We work collaboratively to determine how the next move. Now, we do have authority that has been granted through legal enforcement for quarantine. So we do have the ability to do that, but that is usually a last resort. We attempt to call before we can talk to law enforcement and to determine how we can assist that family or that particular individual before they become a bad actor. So if someone is behaving inappropriately, we would want to know, because we want to determine is that really the case and how we can best help before we even have involvement of any of us actually going there or actually having law enforcement involved.
Okay. It's just a logistical nightmare how you get a hold of somebody you don't have a telephone number for that checks in the hotel. If they don't contact you, that they're in the hotel. So
We know that as people come from other states, that we have the Florida Highway Patrol, they are supposed to visit these individuals to ensure that they're carrying out the expectations of our governor and the directives of our governor.
okay.
That was the only information I have.
Yes, ma'am. Thank you.
Mr. Chair, may I comment on that?
Yes, sir.
Question. Right. The governor's orders, as is put out, the 2082 pertaining to isolation of individuals traveling to Florida. I'll just pick a couple of these vacation rental closures. I'll get to that one in a moment. The governor does say it shall be the duty of every state and county attorney, sheriff, police officer, and other appropriate city and county officials. So probably, each of the public officials here, upon request to assist the Department of Health. So through the governor's order, we are to assist the Department of Health. It may be helpful to have kind of a clarification of that, that sort of procedure. Just maybe even in terms of practical things, as Commissioner Johns is mentioning, what does somebody in the public who sees something do? So we certainly are, available to assist. We can coordinate basically kind of a flow chart, I think, to have this done locally. The state, there are so many moving parts, so many different portions of the state. So many different aspects of this, and we'll talk about some more of those later in this meeting. But I think that that's there. I think it would be useful maybe to sort of localize what the governor's order was for the vacation rentals. The 20-87, which I believe Mr. Conrad had mentioned, that is really under DPPR to act. I am aware that some local jurisdictions are kind of formalizing that for their own county or city, that type of thing. That is something else that could be looked at. But for that one, the governor had directed the DPPR to basically implement that. Thank you, Mr. Chair.
Thank you. Any other questions? I have Dr. Alcock, I would just like to ask some questions about the virus itself. And can you help us with whether it's true or false? Is it true that the COVID-19 does not thrive at higher temperatures and higher humidity?
It's a new virus. We believe that if it operates a little bit like the other coronaviruses, that we would probably see increased activity in colder weather, and that perhaps with the warmer weather, we may have some changes here that might be helpful to us to prepare in the event it does recur when it's colder. But again, the science is not there enough to be able to answer that question as to whether or not there is. I've seen some studies that lead us that way, but I couldn't answer that definitively.
Okay, that's...
We are hopeful, but again.
All right. Any questions from Commissioner Dean or Commissioner Blocker?
Good morning, Commissioners. Linda Stoughton, Director of Emergency Management, St. Johns County, 100 EOC Drive. As you've heard from Mr. Conrad and Dr. A, we've been fully responding to COVID-19 over the last several weeks. The one point I want to focus on this morning is the logistical aspect of what the EOC has been faced with. As we have seen for the last several weeks, is the shortage in the PPE, surgical mask, N95 mask, gowns, shields, and gloves. So the responsibility of the EOC is to take on these missions and work with the State Emergency Operations Center to try and fill the requests that we have for not only our first responders, Flagler Hospital, our local healthcare facilities, and our critical functions inside of our community. We have had some success with that. We have had 98 cases of medical supplies arrive in St. Johns County. As that rolling stock arrives, it goes to the logistical staging area at utilities. We have put together a small team, meeting with social distancing, a small team to go over and break those supplies up, put them in categories, and then have the facilities come there one by one through a period of time to pick up what has been allocated to them. By no means is this what they need to meet all their requirements. This is just minimal of what's coming in from the state of Florida. We're encouraging each and every agency to continue using their proven suppliers in the past to make sure they're getting the quality and quantity that they need, although many of those are back ordered. But we continue to attack this from many different perspectives. So we're using the State of Florida Emergency Operations Center, private vendors, and we've even had some community donations. So we certainly appreciate our community stepping forward to help our first responders with this challenge. So that is one of our major aspects of what the EOC is working on right now. We will continue to fight for those resources for St. Johns County and continue to dole those out in a very methodical way to make sure that it is spread throughout these different agencies that need it for the COVID-19 response. The other thing that's very important for the EOC team right now is information management and discussing this with the public, answering the calls from the public, rumor control, providing them the correct information. We have both centers open. If you would like to call the Department of Health, it's 209-3250 for the call takers. And for our Citizens Information Center, it is 824-5550 at the EOC. The difference in these calls from hurricane calls is when we get the hurricane call, it's usually in what evacuation zone am I in. These calls take more time. I know many of you have been in the EOC and taking calls over the weekend. People need a lot more information, so we're on the call quite a bit longer with our residents explaining this process as we've done this morning. And it's new, so it takes a little bit more time for us to explain the process and what their needs are. A very important function for the EOC. Does anybody have any questions on our response to COVID-19 from the EOC? So I want to talk about one other, because we're so focused on this, I want to bring to your attention this morning that we have the potential for severe weather in the north end of our county this afternoon. So we are under marginal risk for severe weather with damaging winds, isolated tornadoes, and the possibility of hail. Unfortunately, we're looking at only getting about 1/4 inch of rain out of this event. So please monitor the weather this afternoon as we move into the evening hours. So I just wanted to bring that to everyone's attention. We have seen in the past where we're focused on one thing, we need to be focused on also what could happen this afternoon in the northern end of our county. So with that, any questions?
Thank you, Mr. Commissioner Johnson.
Thank you, Mr. Chair. You mentioned personal protective equipment that you're
Yes.
in great need. This is an opportunity to make a public request for specific needs and where those could be delivered, or who to reach out to if any organization has what you need. That can be, the dots can be connected, the resources with the needs. Please take the opportunity if there's anything in particular that is needed, because there's quite a few people who do hear this now and later in the day.
So the personal protective equipment that we are looking for would be the N95 masks, surgical masks, gowns, gloves, shields, goggles, those type of things for our first responders in our healthcare facility. We'd like to get back with the public on where to drop those off to make sure that we are prepared for that and have a team in place. But if you want to look throughout your business, or if you've used these things personally in the past that you are willing to donate, we'd like to get back with you, because we also want to make sure we're meeting those social distance requirements. As you know, the county has suspended some regular collection sites, so we don't want everybody showing up at once. So we will work with our PIO team, with Michael Ryan, to make sure that we roll this out carefully.
Thank you.
Thank you very much.